Okay, let's go through this case step by step like you would in an exam.
So we have a 63-year-old woman presenting with fever and an inflamed right knee. Straight away, those two features together should make you think this could be an infection.
Now, the key piece of history here is that she had a knee replacement surgery 6 months ago.
This is really important because any joint symptoms after prosthetic surgery should immediately raise suspicion for a prosthetic joint infection, also known as PJI. If we look at the clinical signs, the knee is warm to the touch and discolored, which are classic signs of inflammation and infection. The fact that the incision site has healed well tells us this isn't just a superficial wound infection, it's likely deeper, involving the joint itself.
We're also told that fluid has built up around the knee and a sample has been taken.
In real clinical practice, this is exactly what we do. We take synovial fluid to confirm infection.
Now, thinking microbiologically, what organism commonly causes this?
The key answer here is Staphylococcus aureus. Why? Because psoriasis is part of the normal skin flora, is a common cause of post-surgical infections, and importantly, it can form biofilms on prosthetic material, which makes infections persistent and harder to treat. So putting it all together, fever plus inflamed joint leads infection, recent prosthetic surgery means prosthetic joint infection, typical pathogen would be Staphylococcus aureus. So the final diagnosis is a prosthetic joint infection caused by Staphylococcus aureus.
Alright, now let's look at the agar test results for patient 1, and this is where we confirm the causative organism. We already know the patient has fever and an inflamed knee after a knee replacement, so we're thinking prosthetic joint infection. Now we use the lab data to support that. First, MacConkey agar. On MacConkey agar, we see red colonies. This tells us the bacteria are lactose-fermenting gram-negative bacteria, such as E.
coli or Klebsiella.
However, and this is important, this is not the main organism we're focusing on. In deep infections, especially around prosthetic joints, you can sometimes get mixed growth, so this may just be background or secondary bacteria. Next, sheep blood agar. Here we see round, shiny white colonies, which is a key finding.
This is typical of Staphylococcus species, and most importantly, suggests Staphylococcus aureus.
And you should immediately link this to the clinical scenario, post-surgery implant, present asterisk, signs of infection S.
Aureus is a very common cause of prosthetic joint infections. Finally, chocolate agar. We see the same round, shiny white colonies again. This tells us the organism can grow on enriched media, and it supports the identification of Staphylococcus aureus, putting it all together. So although MacConkey suggests some gram-negative bacteria, the key diagnostic clue is the colony morphology on blood and chocolate agar. These strongly point to Staphylococcus aureus. Now let's answer this question step by step, making sure we clearly link the clinical and microbiological data. The most likely bacteriological cause of this patient's symptoms is Staphylococcus aureus. First, looking at the clinical data, the patient presents with fever and an inflamed warm knee, which indicates an active infection.
Importantly, she had a knee replacement 6 months ago, which strongly suggests a prosthetic joint infection, a condition commonly caused by Staphylococcus aureus. Next, looking at the microbiological data. On blood agar, there are round, shiny white colonies, which are characteristic of Staphylococcus species, particularly Staphylococcus aureus.
Although MacConkey agar shows red colonies, indicating lactose-fermenting gram-negative bacteria, this may represent mixed flora and is less relevant in this deep infection.
Therefore, the most reliable evidence is the colony morphology on blood and chocolate agar, which supports Staphylococcus aureus.
So, combining the clinical presentation and microbiological findings, the most likely causative organism is Staphylococcus aureus.
Now moving on to Part B, so we're asked what additional tests can be done to confirm the presumptive identification, which we think is Staphylococcus aureus.
In microbiology exams, the key is to name the test, give the result, and explain what it confirms. First, gram stain, we would perform a gram stain. If the organism is Staphylococcus aureus, we expect gram-positive cocci in clusters. This confirms we are dealing with a gram-positive organism consistent with Staphylococcus species.
Next, Catalase test. The Catalase test would be positive.
This is important because it helps us differentiate Staphylococcus from Streptococcus, which is Catalase negative.
Most important, coagulase test, the coagulase test would be positive. This is the key confirmatory test because it specifically identifies Staphylococcus aureus from other Staphylococcus species.
Additional tests we can also culture. Further on selective media to confirm consistent colony morphology, perform antibiotic sensitivity testing to check for resistance, such as MRSA final takeaway. So, gram stain, catalase test, and coagulase test together confirm that the organism is Staphylococcus aureus.